questions you're hitting.
I'm Porter Storey, the Executive Vice President, and it's my privilege to talk with Cameron Muir, our past president. Cameron, what year were you president? Do you remember?
I believe it was 2007. At least that's what's listed on my plaque with a gavel.
All right. And the challenges that you remember from your year.
When I think back to that point in time, the thing that strikes me as a metaphor is an obstetrician. I think about, goodness, 15, 20, 25 years worth of gestation.
Mm-hmm.
And that 2000, both for the field, the subspecialty of hospice and palliative medicine, as well as specifically for the American Academy of Hospice and Palliative Medicine. From at least my perspective, a couple of things were happening in 06, 07, and 08, in and around the time that I had been on the board for a number of years and then serving as the president of the board, that included, perhaps obviously, subspecialty recognition and ACGME recognition of training programs in hospice and palliative medicine. And that also, so the kind of the developmental stages of hospice and palliative medicine, I think we had our labor and delivery, if you will, in those years where subspecialty recognition occurred and the training competence and content was recognized and validated. That also coincided again, from my perspective, with a profound metamorphosis, I think, of the Academy. We were relatively small, but certainly a lot larger than some of the earlier presidents might remember. We had a couple of different executive directors. I lovingly refer to my pseudo-uncle, Mr. Muir, and then Ann Cordes, who had done a phenomenal job to get the Academy, I think, prepared for delivery.
Yes.
And so that time period around when I was president, I don't remember exactly which year and at which point in time, but that last kind of push of my presidency included a search committee for the executive vice president of the Academy, which one of the markers of success is the longevity and durability of the decisions made. So the team,
I'm very grateful that you decided I should be it.
I certainly didn't. I mean, I supported you as the candidate, but it was a team. You know, one of the fun things was it was really not much of a question, I think, that your leadership was perfectly poised for the Academy at that time. And still just about, not quite a decade later, still seems to be. So that was a fantastic move, I think, in terms of creating, if I'm not mistaken, the first paid physician, round the clock, paid physician position within the Academy, and the voice in the face to some extent from the medical perspective of credibility, which again I think was perfectly poised because of your work in part with the Primer and other things. Secondly, we were dealing with, we'll come to that in a little bit. I think some of the opportunities of growing pains maybe in early after delivery. But then with the executive director role, and also had the privilege of serving on the search committee for the executive director of the Academy. And again, if the marker of success in a process is the durability of the decision. I can remember working with the staff at AMC who were trying to support that process. And I specifically looked, as did the staff there, at over 160, 170 resumes.
Mm-hmm.
And we took it very, very seriously, the review of those resumes and the culling down to then a reasonable group that the committee could review. And ultimately selected, as a group, selected Steve Smith, who continues to be the executive director, CEO of the Academy, again, 7, 8 years later. So, from my perspective, those were, critical transitions for the Academy, critical steps forward. I know the phrase we used back then was capacity building.
Yeah.
And when I talked to Steve yesterday, and he indicated that this year Academy meeting is the largest registration and attendance of any in history,
Mm-hmm.
Well, that's what capacity building leads to, and it would have gotten rickety and fallen apart, I think, if we hadn't had the good due diligence to figure out the leadership, and then have the leadership and the staff level figure out what infrastructure was necessary so we could actually meet the needs of these thousands of people that come to the academy meeting. So those are the things, the gestation, and then just being a privilege. I feel like I didn't feel like an OB attending, I felt like an OB resident.
Really?
Helping to make sure that we successfully delivered to the next generation of the academy.
Wow. Well, as you look ahead, what kind of opportunities do you see for the academy?
Well, I think that it goes without saying, perhaps, that healthcare is probably changing now more rapidly than ever in the time, at least, that we've been a part of practicing medicine. And I think that the value that hospice and palliative medicine contributes to the overall healthcare picture, both quality and efficiency and effectiveness, I think is starting to be recognized, and in some places really being promoted and put forward in a very aggressive way. I remember when years ago I decided to do fellowship training in hospice and palliative medicine. A certain leader in our field, who will remain nameless, said, "You're going into the lunatic fringe of medicine."
Really?
And I've later talked with him, and that same guy said, "Well, now hospice and palliative medicine is sexy." And I think that I'm not sure it's sexy, but it certainly is, I think, more and more a part of the conversation about taking great care of the most vulnerable 1% and the most costly 1%, as a couple of articles have referenced recently. And I think that the Academy has the opportunity to continue to be the voice and provide a lot of the leadership for the medical expertise in the care of that costliest 1%. And if that isn't a value proposition, I don't know what is. But we can't do that in the classic hospice IDG way of going out and thumping to educate the attending physician or whoever else. It has to be a partnership, and I think pretty intentional language as we work with the cardiologists and the Cardiology Society, and the pulmonologists and the critical care and pulmonary groups, and the oncologists and the oncology societies, and the AMA, and really as well as the folks that are trying to figure out how to implement Affordable Care Act, and accountable care organizations and patient-centered medical homes. We have to be a part of that solution, and that's a partnership that I don't think anyone in healthcare, we're so siloed in general, I think, unfortunately. I think that our work is to continue to knock down the silos, build partnerships, do what we do best, which is facilitate goals of care discussion and great communication with the patient at the center of the discussion.
Well, what kind of characteristics and do you think our future leaders are gonna need?
Well, so it's interesting. At Capital Caring, we have 5 criteria by which we evaluate our staff. The first criteria is competence. That can be taught in most people's framework of thinking, and so competence is a ticket to play, but it's also something developed and verified or validated that someone's competent. So that's kind of baseline. And I think that the work we've done as a field with board certification in hospice and palliative medicine, and the new work that's been established in the past couple of years with the HMD certification board and that examination, I think are markers of the credibility and determination that we have for competence in our field. So I think that's number one. That's a foundation. Then the other 4 are debatably teachable, and that is attitude, work ethic, integrity, and commitment. And I think from whether you're a nurse or a physician at the bedside, an attitude of service, a heart of service, a work ethic that is to some extent tireless, and I think that's one of our challenges as well, that the need is so great. The number of people suffering is far greater than the number of subspecialists. So I think that the commitment to the future health of America is not only to the junior folks in hospice and palliative medicine, but also to the staff nurses in the hospital or the hospice who are going to be doing the primary palliative care for the future, so that we can actually build the true capacity for the families as well as the subspecialty capacity. The integrity to make sure that we're doing this for the right reasons, with quality at the center of our efforts and the family at the center of our efforts. And then ultimately, kind of part of what we're trying to do in our shop is a joy. A joy to be at work, a joy to be with the people that we have the privilege of both serving and working alongside. And to keep that joy and that spirit fueled. So the attitude of service with a spirit of joy, work ethic, integrity, and commitment.
Wow, quite a package. Any closing words for our listeners about the future of hospice and palliative medicine from your view?
The only important comment I would make is to assert one's self in the realm of service to the academy. To my knowledge, you remain the only paid physician at the academy. So all of the stuff, whether it be educational content, program planning for the assembly, position statements, and the list goes on and on and on. You know far better than I all the different niches of work that the academy is doing. There is a great staff. Steve Smith reminded us last night that there are 15 of them, and that's all. So between the paid staff, the rest of the work gets done by the potentially thousands of volunteer physicians and members of the academy. And it's never too early to reach out to ask to help in just a little way. You never don't know enough. You never maybe don't have enough time, but you don't never know enough. You can always put yourself out and contribute something to service for the academy. That's where the future leaders are going to be built. We need that service, and I think the academy's done a great job of grooming a lot of the future leaders of today.
Great. Well, thank you so much for sharing these comments. We're grateful for your wise words.
Thank you, Porter, for the opportunity.